Steven, why don't you believe in aspiration?
For a number of reasons. Firstly, to do aspiration, you need to keep completely still. And the patient needs to keep completely still. Now, what are the chances of that happening? And there are some studies to show that even when you think you are completely still, looking at ultrasound, there is still movement by a few millimeters, which is very significant. So I think it gives a false sense of reassurance. The evidence for it is not terribly strong as well. We know that there are lots of false positives and especially false negatives, which are a big problem. And so the other issue with aspiration also is that there's no standardized way of doing it. And there are so many variables involved with doing it too. I mean, from the type of material, the type of needle, etc., etc. So I think that there's a lot more that needs to be done in terms of understanding the process and also trying to standardize it. But even so, I think that it's a no-go from the beginning, simply because you need to keep still. And to me, it makes a lot more sense to keep moving. I think that is a much better safety measure. It's advocated by the consensus for filler-related blindness. So they advocate continuous movement, which is what I do. And of course, I think the safest way to inject is really under ultrasound guidance, where you can actually visualize what it is that you're seeing. So aspiration, not really. I think it's more to make the injector feel better. And I think that if you employ it, it should be somewhere at the bottom of safety measures. There are other things you can do besides ultrasound, which is also injecting under low pressure, injecting slowly, etc., etc.
So in your opinion, yeah, okay, that's fine.
Long answer.
In your opinion, are ultrasound an option for aesthetic doctors?
Well, I don't think it's an absolute must, and I don't think it's helpful to advocate it as such. I think that could put a lot of people off it, actually. But I think it adds another layer of safety to what we do, which is that it allows us to visualize what it is that we're doing. But, look, I mean, you can also have a vascular adverse event under ultrasound guidance. So it's not 100% safe. And it's also very heavily user dependent, like much of what we do. So you really need to know what you're doing with ultrasound. A lot of people think they can just go out and get a device and that's all you need. But that's really just the beginning. And I even recommend doing courses before you go out and invest in that technology. So is it an absolute must? No, but I think it certainly does add a layer of safety, provided you know what you're doing and you're doing it correctly.
Okay. And which criteria do you use to determine if a patient really needs a lip treatment?
Well, first of all, the word need, I think, is a bit of a problem, because I think we have to be careful. A lot of the procedures we do are elective to a large extent. So I don't think anyone needs anything as such. But a patient certainly may feel that way, or may certainly want to have lip treatment. And then there are certain criteria. It depends on what exactly she's asking for. So for example, if she's asking for some trendy sort of look, or especially if she's asking to be overfilled, we need to be very, very careful with a patient like that, because there might be some sort of underlying psychological problem.
Yep.
We talk about body dysmorphic disorder, but there is also a condition called perception drift, where the baseline for normal keeps shifting. So a patient may feel that, for example, her lip fillers have gone, but they're not, they're still there, and she keeps on having more and more and more, and the practitioner keeps giving her more and more and more, and then that becomes a problem. And more and more and more. So so it depends on the patient and what she's requesting. And then there are certain types of lips which are appropriate to fill and others which are, let's say, more suitable for something like a surgical lip lift. So for example, if your upper lip covers your upper teeth, like it does in my case, we know that fillers will not give you a lift. They project in a direction of least resistance. So someone like that may be more appropriate to have a surgical procedure which will shorten the filtrament and lift it up. So I think that's just a flavor of how we choose things. Yeah.
And why is it so important to preserve the natural essence?
To preserve the natural look. I think generally, first of all, I think that's the way aesthetic medicine is moving towards a more natural look rather than making everyone look the same, which is a big problem. And I talk about that in relation to lips. So we just did a recent study which was published in Aesthetic Surgery Journal, where we found that 70% of presentations on Instagram are exactly the same lip type, so exactly the same lip shape. Whereas in the normal population, only around 15% had that particular lip type. So Instagram is actually setting a beauty standard and sort of making everyone look the same. And we've got to be careful about that because it destroys human diversity. And we're here to celebrate human diversity. We're here to enhance and not change and make everyone look the same. And of course that applies to the whole face as well. So to maintain each individual's unique beauty and function, we have to look at producing more natural looking results.
Dr. Steven, thank you very much
You're
for
welcome.
your time.
Thank you for your time.
And for your knowledge.
Thank you.
You're welcome.
Okay.